This is a review of the tibia and fibula bones. Let's look at the tibial bone as it sits in anatomical position, and we will look at the anterior aspect of the tibia first. First we get a tuberosity again, tuberosity extension from a bone. This is the tibial tuberosity, and the patellar ligament comes from the patella to the tibial tuberosity, and as the knee flexes, it puts tension on the bone and creates the tibial tuberosity. Of course, this is the shaft or diaphysis of the bone, and when we get to the distal end of the bone, we get to the articulation with the talus of the ankle. We will also notice that we have a rather large bony protrusion here, and this is called the medial malleolus. The medial malleolus, if we were to observe the medial malleolus along with the foot, we can see that the medial malleolus, which is here, and it's on the medial or inside, it acts like the styloid processes of the radius and the ulna to lock the ankle joint in place. It stops the ankle from moving sideways. So the medial malleoli, the bump on the inside of your ankle, helps to stop the ankle itself, the talus bone, from shifting laterally or medially. Well, laterally, it's stopped by the head of the fibula, fibula, and medially by the malleolus on the tibia. So that's what the medial malleolus represents. It's a lock for the ankle. Let's look at the posterior aspect of the tibia. If the posterior aspect of the tibia, and we can see that it has two epicondyles, epicondyle here and an epicondyle there. The word epi, of course, means upon. The condyles themselves are here and here. Now the condyles are the place where the condyles of the femur articulate with the condyles of the tibia. Another anatomical structure is the intercondylar eminence. So the intercondylar eminence is this rise of bone that we see between the two tibial condyles. The intercondylar eminence. Now, a meniscus would sit on this condyle and on this condyle. And these eminences assist in the maintenance of the integrity of the meniscus. So those are the anatomical structures of the tibial bone. The fibula is a bone that articulates only with the tibia, and it articulates at the tibial head and at the distal aspect of the tibia. And ultimately, it's a bone that is meant to absorb weight and has very few anatomical structures. It has a articulating facet with the tibial head, and it has an articulating facet which would articulate with the talus bone. This aspect is the lateral malleolus, and this aspect is the head of the fibula.